Hi everyone, welcome to Buckle Up Podcast. I'm Natalia Earl and I'm a certified business and life coach that loves talking to people. I'm fascinated by humans and how our brain works. What is it that makes a decision good or bad, and how does that decision ultimately shape our path and destiny? Everyone loves to talk about success, but what about the flip side? How about adversity? Failure is such a big and often necessary part of life, and it's simply unavoidable. So I invite you to join me on this inspiring, honest, unpolished interview show with breathtakingly real conversations that go deep on setbacks and hardships that are part of the puzzle that ultimately lead to growth, discovery of inner greatness, and what makes us resilient. Grab your helmet and buckle up, people. It's going to be a bumpy ride. But what a ride it will be. Today I sat down with Dr. Kaitlin Haider, who has been passionate about health and fitness her whole life. Growing up an active young girl, she was always seeking help from physical therapists to keep her body healthy, active, and strong. Dr. Kaitlin co-founded Fit PT with her mother, also a physical therapist, in hopes to provide women with a better quality healthcare for their bodies. A healthcare that would put the power and decision-making back into patients' hands rather than large hospital systems and insurance. She combines her sports medicine, fitness training, and pelvic health knowledge together to provide her patients with a well-rounded and customized approach. Her favorite thing is teaching women how to reconnect to their core and pelvic floor muscles through Pilates-based movements.
Is a really great question that has a really gray, large answer. But
Right.
one of the things I'd like to say, Natalia, is that pelvic health oftentimes is something that women don't realize, that we all have a pelvis, we all have a pelvic floor. Those areas of our body are working for us all the time, and it's not. Pelvic health isn't just for individuals who are pregnant or who are postpartum or who are experiencing pelvic pain. That certainly is a time to seek out a pelvic health physical therapist, absolutely. But I think this wonderful bout of education is now coming and moving forward in our communities and social media, where people are becoming more aware of pelvic health as something that women should all seek attention and care from, just like we do our other providers. And I think what's really cool is we're starting to talk and recognize as women more of like what is normal and what's abnormal. And I'll just share a little bit personally that as a young child, I was a gymnast growing up,
Mm.
pretty competitive, and also a runner. And I can say from those two sport experiences, I struggled with urinary incontinence as a child and a teenager. And I didn't really tell anybody about those, leakage issues and experiences. I just sometimes would pack extra clothing for practice just in case, because it wasn't really, I didn't recognize it as being maybe truly abnormal, or I didn't know what to do about it. And it's a very shameful, embarrassing experience as a young woman. And I think whether you're a child or an adolescent or adult, I think, recognizing that that wasn't normal would have been really helpful and beneficial for me. And it wasn't something until I was an active professional, a doctor of physical therapy, and I was working alongside pelvic health specialists in my practice and hearing about what actually was happening there. I'm like, oh gosh, that was me. I hear this all the time, especially from women who have maybe had children and have struggled with leakage. That's just a big topic that we talk about in my practice, is bladder leakage. And a lot of women didn't realize that, like, I didn't know that there was anything different. I just thought I had babies, and I kind of got this badge of honor into motherhood with some leakage and having to wear liners, and that just is what it is, and that's not true. And there's so much we can do from a pelvic health standpoint to help support women in, supporting their bladder, their bowel function, their sexual function. And we all have a pelvis, males and females. And so learning about them and taking care of them is really important.
Yes. And so, Dr. Kaitlin, you speak about breast reconstruction on your website.
Mhm.
What does that have to do with pelvic health? Can you
Yeah.
tell me a little bit more about that?
Love that you're bringing this up, Natalia. So this is, first I want to share, like, we serve the woman as a whole.
Right.
Okay. So the pelvic piece is really big because I feel like that's definitely a niche and a specialty, but we treat the whole woman in her physical body. And so one of the areas that's more recently been an interest of mine is the breast reconstruction and rehabilitation, because there's not a lot of physical therapists out there that are aware and who are serving women in this area of their body. So, as a pelvic health physical therapist, we're getting super intimate with our clients and talking all about pelvic floor and the pelvis, and that's wonderful. But, like, what about what's going on up top? And so, for one reason or another, if a woman has undergone a breast reconstructive surgery, whether that they have had implants in or removed, they've had a history of cancer and treatments, whatever the history is, there's some pretty significant trauma and scar tissue and different things that have changed in their body physically. The
Mm,
muscles, the tendons, the tissue, it all changes. And so, for whatever reason, for some reason in that surgery in particular, why are we not suggesting that these women get physical therapy care? That should just be a standard. And I can speak to this personally because I've had breast implants put in and I've had them taken out. And it is a huge detriment to the body. It's a huge demand on the body to have that procedure. And I needed assistance in healing and movement and even just permission and education in what I should and shouldn't be doing, because it's a big surgery. And most clients who come to see me have a problem they're working through, right? They're
right.
frustrated. They've tried to do the do it yourself at home YouTube videos that aren't working, and they're just like throwing their hands up coming into my office, pretty frustrated. And as we start to work together, a lot of times through their success stories, they're looking to me and they're saying, Dr. Kaitlin, how come I didn't know this? How come I didn't know this
Right.
existed? How come I didn't have this information? How come this isn't being talked about and taught to every young woman and child? And I don't know the answer to that, but I do know that myself, along with a lot of my colleagues in pelvic health, are aiming to serve women and educate women in our communities about this information, to know that it's there, to know that help is available, that you don't have to live with this discomfort or this question of, I don't really know what's happening in my body and I feel out of control. And then, two, I hope that these adult women who we're serving are also teaching their young girls. I think that we can
Yeah,
just create such a momentum for change in our future generations through that.
definitely. And that's so important
Mhm.
because once we feel safe and comfortable, we tend to open up and asking those right questions because before someone else asked me the question, I didn't even think about it. And
Yes,
I'm one of those people that once something is brought up to me, that I know how to fix it, but I can't
yes,
necessarily flag it.
yes. Oh, it's so true.
Yeah.
It's so true. And on a personal level, speaking about trauma and speaking about my profession, and we talked about the breast implants a little, I've been there myself. And one of the things that has been the most humbling for me in the last year or two is recognizing those underlying traumas that I didn't even see myself. And it
Yeah.
wasn't until I was faced with some health challenges that I recognized how much it was impacting me. And I'll speak to the breast implants because as a young adult, as a teenager, I was very self conscious about having a
Mm,
small chest. I was very self conscious about my body image and became, at points in time in my life, obsessed with an ideal body image. And it became very unhealthy. And I was determined as a young adult woman to get these implants, and I believed that they were going to make me feel better, that they were going to solve these issues that I felt insecure about myself, right?
right.
And at that time, I was in my early 20s, I was young, and I just felt, if I get this, then I will be happy. And what's so interesting is that as soon as I had these implants put in, it didn't take away the unhappiness. It didn't take away the insecurities. If anything, I had large regret over it. And I had not only emotional pain, but physical pain too. And it was something that I kind of swallowed my pride, because I decided as an adult, as a responsible person, I chose this. This is my journey. Suck it up and deal with it. And I didn't realize how much that was weighing on me until I got my implants out. Yeah.
Your professional career, Dr. Kaitlin, did you find that body tends to carry past traumas?
Oh, 100%. 100%. In especially low back pain and pelvic dysfunction. And that's something that, when I'm working with a client who maybe this is new to them, maybe I'm one of the first providers that they're ever seeking help from. Especially if I've developed a rapport with somebody, I will oftentimes ask them what type of support that they have at home, in their community, family and friends. Do they speak with a therapist? What kind of support do they have? And it's interesting to see how many people recognize whether they do or don't have trauma. Some people are very aware that they have trauma. And, I think when it's something in regards to, sexual trauma or physical trauma that is very